Good afternoon, and thank you for joining us. My name is Tim Coffey, Senior Director of Development at the OHSU Foundation, and on behalf of the entire Foundation team, we are honored to present today's discussion, Necessity is a Mother of Invention, featuring Dr. Albert Chi. OHSU was fortunate enough to recruit Dr. Chi in 2016 from Johns Hopkins University. He now serves as a trauma surgeon, associate professor, and faculty member of the Donald D. Trunke Center for Civilian and Combat Casualty Care within the OHSU Department of Surgery. He is also the director of OHSU's Targeted Muscle Reinnervation Program. Dr. Chi is a retired U.S. Navy commander and served in North Africa as part of Operation Enduring Freedom. He regularly puts his surgical and leadership skills to work through humanitarian service in places such as Haiti and by mentoring young people. An engineer by training, Dr. Chi earned a master's in biomedical engineering before pursuing medicine. Beyond being an accomplished surgeon and inventor, he's a true innovator with a deep commitment to making our world a better place. Before we begin our conversation with Dr. Chi, I'm quickly going to go through some housekeeping items and how you can engage with us. We will be using a chat function which can be found to the right of the viewing screen. In order to participate in the chat, you can log in via your Vimeo or Facebook account or participate as a chat box guest by selecting the Chat as Guest blue link. If you need assistance at any time during this live stream presentation, email fdnevents@ohsu.edu. We are going to copy that link into the chat box now for your reference. Please note this presentation is being recorded and will be available for viewing on the OHSU Foundation website at a later date. We will email a link to the video once this recording is available. And with that, it's my great privilege to introduce Dr. Albert Chi, engineer, inventor, humanitarian, brilliant surgeon, and one of OHSU's true stars.
Well, I often tell people I have the greatest job in the entire world. I get to combine both my passions of surgery and my passions of engineering in my clinical research. Not only have I had the honor of serving the civilian population, but the military population as well, using my clinical research to help those wounded warriors who've risked their lives and have actually given and lost their limbs serving our country. You know, wearing my military hat for a second, would you believe if you're wounded in this current conflict and you return home, over 80% of those individuals have lost a limb? This is really multifactorial, partially due to the body armor that we are issuing our soldiers. It's wonderful protecting the torso, but it leaves the extremities exposed. But really, the reason for this is the weapon of choice of our enemy. It's the improvised explosive device, the IED. These high-energy explosive devices cause horrific injuries, sometimes the loss of one limb, 2 limbs, 3 limbs, even all 4 limbs. And I've had the privilege of taking care of these wounded warriors returning home, and you could not ask for a more motivated group of individuals. All they want to do is to get their lives back in order, contribute to society, and you guys, believe it or not, they want to return to duty. However, if you look at the distribution of those who are actually able to return to active duty, it's only applicable to those who have lost a lower extremity. And this has to do with this huge technology gap between upper and lower extremity prosthetics. In recognition of this, the Department of Defense actually challenged the Johns Hopkins Applied Physics Lab to come up with an engineering solution for this. And what they came up with was something called the modular prosthetic limb. It's called modular because it can replace limb loss at every amputation level, from the hand, below the elbow, above the elbow, even at the shoulder. Not only is this motor capable, but it's sensory capable as well. There are over 200 sensors in the limb. It can feed back temperature, pressure, velocity. We can calculate acceleration. We know the exact position of the limb from second to second. We could potentially feed back even proprioception if we had the right feedback to the patient. Anything the human arm can do, this limb can actually emulate. Well, it's one thing to talk about this limb, but I'd love to show and share this video of Matt here, who's an engineer at the Applied Physics Lab. He's wearing a cyber glove, which is mimicking all of his hand motions. There is a positional sensor at his elbow as well as his shoulder. And you can see here the small object manipulation. He can even operate tools. I'm gonna boast to everybody, I would not have even had to have been deployed back in 2015 if I had 2 of these limbs. operated through teleoperation with the right visual and proprioceptive feedback. That's how dexterous and capable these limbs are. So now that we've created this incredible feat of engineering, how do we control this for the amputee? I'd like to introduce everybody to Johnny Matheny. Johnny is my first targeted muscle reinnervation patient. I'm going to refer to this as TMR. And the key to controlling the modular prosthetic limb is TMR. It's an advanced surgical procedure which we've rewired the nerve endings of the cut amputation site. So all of the neuronal information that used to travel to the missing limb is now rerouted to residual muscles that are still present. So now when Johnny thinks of missing or moving his missing limb, it now contracts those new muscles we've rewired. Not only is Johnny the first person to have TMR at Johns Hopkins, but he's also the first person in the US to have an osseointegration implant. He really is a pioneer for prosthetic technology. And what osseointegration is, it's actually an intramedullary rod that's implanted into his humerus. It's externalized and actually acts as a direct skeletal attachment that Johnny can, with a quick release, put his device on and off. Currently, the system is completely wireless. We have a myoband that he wears around his upper arm that reads all of the muscle activity. We actually have a phone app that he uses to train to make all of his classifications. And again, folks, to stress, after targeted muscle reinnervation, it's intuitive control. Johnny simply thinks of moving his hand, his wrists, his fingers, and he's able to control it with just simple thought. I'm also proud to say Johnny's the first person to be able to take the modular prosthetic home for a long-term duration. He participated in a year-long study, and at the end of that study, Johnny actually learned to play the piano. This is another patient of mine, Les. He lost his arms 40 years prior from an electrical accident. The key to the success, and again, you see in this video, Les has complete control of bilateral arms with all the joints simultaneously. He's using his mind, thinking of moving his shoulder, his elbow, his wrist, and his hand. And the key to all of this has been virtual rehab. We have created a virtual interactive system where you have a virtual representation of the limb, and we actually reinforce those neural connections post-surgery that allows us to classify and add more movements with repeated training. There's something called a confusion matrix where you see in the upper right-hand corner. This is Les's kind of report card represented as a perfect score with a white diagonal line for his both left and right hand. Another interesting story I'd like to share about Les. There was one point where after years of participating in research and with multiple breakthroughs with demonstrations and Les's capability with the modular prosthetic limb, Les actually came to me one time and said, "Hey, Dr. Chi, I don't think I can participate anymore." And the reason why he gave me that he didn't want to continue with the studies was that he said every time he came here, it was as if he was given, and then the world completely opened up to him and given his arms back. But every time he left, it was as if he had lost both of his arms every time when he got on that airplane. I got to tell you, that conversation and comment really hit home for me. It was really a turning point in my career where it was wonderful that I was involved in such advanced research, but it was less than inspired me to kind of go down another path to look for something that was more affordable and accessible to anyone in need. This journey actually led me to a nonprofit called Enabling the Future. Enabling the Future was almost this disruptive technology using 3D printing to create prosthetic devices. The initial designs were aimed for children who were born with congenital limb loss. They were very basic designs that had children who required still having a wrist. There were body-powered hands, essentially, that when you flexed or extended your wrist, it was able to have gross grasping. My greatest contribution to Enabling the Future was really the advancement of not only prosthetic hands, but a prosthetic arm. This video here is John, who, within minutes of fitting, we used a basic figure-8 shoulder harness here, and you see John reach up for a cup, and he's able to grasp something for the first time. Now, as wonderful as this was, we got a lot of media exposure and we took a lot of pictures, and this is a wonderful video. John gave me some very valuable feedback. First off, 3D printed sockets just weren't ready for prime time. You see the socket there, although it was able to pick the cup up, If we had any weight added to the arm, the socket would slip out and he would actually drop whatever he had in his grasp. The other comment John had was also it was very hard, although he could grasp an object, he couldn't bring the object to his mouth to actually take a drink. Although this would make wonderful videos, it wasn't functional. It really shifted our focus to, we needed to come up with a design that was functional with activities of daily living. This led us to really coming up with, why should we reinvent the wheel? Let's come up with a hybrid device. Let's incorporate our prosthetic and prosthetist colleagues to come up with traditional prosthetic sockets and come up with 3D printed terminal devices. As you see Ollie here, he actually has a gripper hand, and Ollie has been born with a missing below elbow upper extremity limb deficiency. And his father had always told me that he always thought Ollie was actually right-handed. And believe it or not, after having this gripper device, Ollie actually prefers to write and brush his teeth with his right hand. With the traditional socket, we've actually able to have custom designs for our patients as well. This is Ollie here. He always wanted to play T-ball, and we created him a custom T-ball attachment, which is the same attachment with his gripper hand. And he was able to hit the ball 20 feet over my head, which was a picture taken here in front of my office. With how functional these limbs were, we quickly transitioned to adults. This is another John. John was never satisfied with traditional prosthetics throughout his life. Fortuitously, we actually sat next to Johnny and I, when we were traveling to give a talk on the airplane. And this prompted this conversation. We exchanged phone numbers. And within a month, we created John, this hybrid device. Again, this is a traditional socket with the collaboration of a local prosthetist and the terminal attachment of the gripper hand. Pictured here is Charles. Charles had a bout of sepsis, which resulted in the loss of all 4 of his extremities. Believe it or not, Charles was a professional musician before this bout of illness. And we met Charles once he was out of the intensive care unit while he was still on the ward recovering. And all he wanted to do was be able to play his instrument again. So while he was still in the hospital, our team gave him a visit. We used our 3D scanner and created a custom attachment that fitted his exact amputation site so that he could actually play the steel guitar again. And as you can see here, we created a custom pick as well as an additional attachment that allows him to play the beautiful music you're hearing. So the next phase of where we wanted to go was there a way we could be a one-stop shop and provide all of your prosthetic needs with 3D printing? And this really led to the design of a 3D printed flexible liner. This is a dual mesh design, which almost acts as a finger trap that actually, with weight or any kind of pulling, will actually clamp down on and safely and comfortably on the patient's residual limb. This design is customized for every single patient. We were able to come up with the printing algorithms to able to have this dual mesh design so that when we have a patient, we no longer have to reach out to the prosthetist and can complete all their needs from beginning to end with very low cost. I'm really proud to say we are truly a crossroads of incredible technology and accessible disruptive technology through 3D printing. And I'm really proud to say we're combining all these different things. I was, prior to the pandemic, thought that the next project I'm going to introduce to everybody was going to be my greatest contribution to academia. And this was the OHSU powered exoskeleton. What the goal of this project was is a lightweight 3D printed exoskeleton that can be applied to individuals either with brachial plexus injury or even stroke injury. Did you know there are over 7 million individuals in the entire US right now who have stroke, and 77% of those have some sort of upper extremity deficiency? You're able to lift your arm, however, maybe you can't actually hold a device or hold something in your hand. What we came up with was a lightweight design because it's cable driven. All of the hardware can be actually externalized and wore as either a backpack or a fanny pack. All of the technology and pattern recognition and control algorithms that I learned working with the modular prosthetic limb can also be applied to the exoskeleton. We've now combined that technology with our 3D printing technology and everything we've learned up until this point. We are able to provide this at a fraction of the cost of other technologies that are available. Now this leads us into what's on everybody's minds nowadays of COVID-19. This was back in April. I was the ICU attending, and we were looking at the Johns Hopkins Coronavirus Resource Center and just really commiserating about the total number of confirmed cases, the total number of deaths. And at this point, too, we were faced with the real fear of a potential ventilator crisis in the US. Not only the US, but the entire world. And at this time at OHSU, all research was suspended because of stay-at-home orders. And it was here I had the epiphany that all of my experiences, being a trauma surgeon, an ICU doctor, with 3D printing and all these advanced technologies, that my lab was perfectly suited to come up with an engineering solution and 3D printing solution for a 3D printed crisis vent. Within 2 months, we came up with this design. This is completely 3D printed, which requires no electricity, completely flow driven, that fits in the palm of your hand. Not only is this capable of basic ventilation, but advanced ventilation as well. Our current status with this is we've applied to the FDA for emergency use authorization. We've passed all of the performance tests right now and are currently looking for a distribution collaborator. We also have brought on board 3D Systems, who has graciously offered to gift all manufacturing costs and is capable of printing up to 100 ventilators per week. Here is one of our testing where we ran the ventilator for an entire week. You can hear the ventilator almost breathing. It has almost a Darth Vader sound to it, but this is music to my ears. We were able to have zero performance changes over the entire week. It was just absolutely amazing. We were all so excited for the potential of this device. And given that it requires no electricity and only flow, I think there could be great potential, even beyond the pandemic, for hostile environments, developing countries, for this to be a long-term solution for many places with very limited resources. There have been so many people involved with all these different projects, and I couldn't even begin to thank everybody. But what I'd really like to thank is the OHSU Foundation. Without their support, none of these projects would have been possible. And I'd like to stress to everybody, all of the projects you've seen today involving 3D printing has been supported through philanthropy. So to all the viewers out there who are supporters and donors, thank you so much. None of this would have been possible without you.
Thank you, Dr. Chi. Wow, fascinating stuff, from thought-controlled bionic arms to 3D printed exoskeletons to an incredibly innovative solution to address a global pandemic. I would now like to open our Q&A portion of this live virtual event. As a reminder, you can participate during the Q&A via the chat box feature on the right side of your screen. Our chat box moderators are standing by to assist. And with that, let's get our questions going. Okay, here's our first question. Dr. Chi, you have an incredible background. How has your military service influenced your work today, and what drew you to OHSU?
Tim, that's a great question. Really the military service and working with our wounded warriors has been a great personal influence for me to do clinical research and try to provide these advanced technologies to them. Because in my opinion, there is no one more deserving than those who have risked life, and I mentioned this in the talk, given their limbs to help protect our country and our freedoms and our rights. And it's beyond just the amputee. The modular prosthetic limb has so many potential applications. We showed, pictures of Johnny using the limb after losing his arm. But if you can imagine, we mentioned that teleoperation. The MPL could literally be placed on a robot. There is a prototype called Robo-Sally. We can actually deploy Robo-Sally to disarm some of these IEDs. And instead of putting the EOD members out and putting them in harm's way, why don't we do and develop a low cost, inexpensive robo-Sally that if injured, there's no life lost. Not only that, we could even at the entry control points, having served, even getting onto the base, it's a real source of potential danger of vetting people to let them on, having access. And also this is a really vulnerable area for our enemies to attack. Why have a soldier even placed at the entry control point? We could have an avatar, MPL, check IDs with all the different, visual feedback. Would even have another remote side checking credentials and things on the backside. It could even be more efficient. Essentially taking our soldiers, our men and women, our servicemen and women out of harm's way. And to the question of why I came to OHSU, it really was kind of this military support. My boss, Dr. Marty Schreiber, he is a colonel in the Army Reserves. And OHSU is a military training center for a civilian setting for those getting them ready for deployment. And many of my partners are also in the reserves and have military service. And it was Dr. Schreiber who recruited me over here that made just OHSU the absolute most perfect fit for me. I began my talk by saying I have the best job in the entire world. Well, I'll be honest, that statement has never been more true since joining OHSU.
Wow, that's great to hear, and really is an incredible background that you have. Let's see, our next question. Is targeted muscle reinnervation an experimental surgery, and is anyone with limb loss a candidate?
Another great question, Tim. So when we first did Johnny's TMR surgery, I got to tell you, it was kind of out of the box thinking, almost borderline experimental, but that's been over 10 years ago. And most recently, TMR has entered the mainstream, and in my opinion, should be the standard of care for any amputation, not only for upper, but lower. And the reason for this is that after TMR surgery, there is a significant improvement of phantom limb pain and neuroma pain. This is really debilitating for amputees because of that neuroma pain. Many times you can't even fit a socket on the individual because the stimulation of that scar tissue that's formed on those cut nerve endings, that they can't even be fitted for a prosthetic device. And what we've shown, and really there's been very recent elegant research and paper publications that have shown TMR is significantly improved over any kind of rehab or even medication. That here at OHSU, we have started a new TMR program and initiative that for all amputees, we will make this standard of care.
Wow, that's amazing.
The second part of your question. For people that are candidates, anyone is a candidate. However, for advanced prosthetic control, usually it's reserved for those people with higher amputation levels, those with either above elbow or shoulder. Because we've come so far with pattern recognition and control algorithms, for people missing limbs that are distal to the elbow, we can actually still have individual finger control and pretty advanced control without the need of having additional surgery. But however, regardless, we still recommend TMR for anyone with limb loss.
Wow, I was just going to say that this is really quite amazing. It's to think of this as a standard of care rather than this futuristic exception to the rule is really pretty amazing. Let's go.
I really should say too, this has been really out of the box thinking for all the different divisions too within the Department of Surgery. I mean, we are collaborating right now with the trauma division, the orthopedic division, neurosurgery, as well as vascular surgery. So it's been a wonderful collaborative effort for us to provide the best care for all our patients here at OHSU.
Is there a risk of infection with osseointegration?
Yeah, that's a real risk and fear a lot of people have. And I have to tell you, OI was inspired by dental implants. There is a long track record and history of this technology just applied to a different area. Now, in saying that, there is a small risk of osseointegration getting infected. And I think it's the responsibility of the medical community for the correct patient selection. Johnny, again, who was the first person in the US to have OI performed for the upper extremity, there are times, Johnny has pushed the envelope for this, and he has gone in public swimming pools, believe it or not, against my own advice, has gone into the ocean, and has never had he's never been placed on antibiotics. There's never been a single fear for infection for him. But at the same time, we have to be careful with the patients we recommend this for. And at the same time, sometimes we got to hold our patients back and tell them, just because you're strong and we need to take all the precautions, that you shouldn't try to push the envelope so much sometimes.
Wow. Okay, we have a really interesting question here. What is your favorite facial expression?
Oh, okay. Let me think about it. Okay. So I'm a trauma surgeon, and those in the audience may not know this, but before I became a trauma surgeon and went to medical school, I was actually getting my master's in engineering, and I was involved in a very horrific accident. And I was a trauma patient long before I was ever a trauma doctor. And that was probably one of the worst experiences of my life, but the best experiences of my life, because it put me in a whole new direction in where I am today. But as that trauma patient, there was a lot of fear there. People were talking about you and not to you. And that experience I carry with me all the time on every patient that I see now when I'm on trauma call. I try to make a point with everyone that comes in while they're still in their C-collar, strapped down on the backboard. I will look them straight in the eye and try to connect, introduce myself, call them by their first name, and tell them, hey, we're going to take care of you. Things are going to be okay. And my favorite expression is that look of relief on their faces after that moment. And no matter how busy the day is, or the trauma pager is going off nonstop, I look forward to that moment when I can actually interact with our patients.
Wow. I love these personal insights. Speaking of that, you shared with us the stories of your patients during your presentation, Johnny, Les, and Ollie, and how their lives were changed because of your work. Have the designs and technology evolved since you first met these patients?
Oh my gosh, Tim. Yeah, I mean, really, because of the engineers and the research lab, our designs are changing and improving. It seems like almost every lab meeting. The great thing with Ollie is he's growing so fast that every 6 to 9 months we have an opportunity we have to upsize his device regardless, because he's growing so fast that we always introduce new ideas and new technologies. Right now we are partnering with Leica, which is a stop motion company that's local, and we're creating a myoelectric device, not just that passive device that we showed in the talk, for Ollie. And not only will it be functional, but we're going to hopefully have it super creative and fun for him as well from an artistic standpoint. So, right now, everything is progressing so fast with everything available to everyone at their fingertips. Electronics are becoming more inexpensive. All of the pattern recognition and software is all open source, that really, we are only limited by our own imagination at times. So I honestly, there are times I look forward to the lab meetings, because I'm just so impressed with what the engineers in the lab have come up with. And, we're also energized by the conversations and the possibilities that things are changing all the time.
Wow. You mentioned also that Les was reluctant to participate in future studies. And so I'm just curious, have you spoken with Les recently? Do you have any follow-up with how he's doing?
Oh my God, I'm so glad you asked that. I didn't want to leave everyone in the audience as if Les, lost hope and did not have any options afterwards. Shortly after that conversation, and not only myself, but those at the Applied Physics Lab reached out to me and said, we got to do something for Les. He's given so much of his time and volunteered himself. And we ended up reaching out to his local prosthetist, and all flew down. We shared all of our knowledge that we had with the socket fittings, and Les currently has the most current state-of-the-art commercially available prosthetics up to the shoulder bilaterally for himself at home. There's actually a New York Times video piece on Les called Robotica, that if anyone is interested in, it is absolutely beautiful as far as showing Les's true spirit and persistence, that if anyone wants to learn a little more about Les and see a glimpse into his life, it'd be wonderful if we could share that link to people out there to just take a little time out of your day.
Yeah, absolutely. We'll make sure that link gets shared. And it's just so inspiring to hear that Les is doing well. Okay, let's get back to our techie questions. Let's see. Can you talk more about this whole idea of the fusion between machines and humans?
I've given this talk before and have entitled it Bionics, the Evolution of Man and Machine. And we are really living in a time of incredible breakthrough surgery and breakthrough technology that I truly believe in that statement. Things are becoming more implantable, as again, the electronics can catch up to what the medical community can feed back. And with the correct training things that are available, like especially for us, what separates our TMR program from other programs is that virtual training I was talking about earlier. We're creating almost this whole new field of medicine of virtual rehab, where, before you even consider having prosthetic fitting, you can come in and show performance. And again, reinforcing all those neural connections after TMR surgery, where you are ready to go. It's almost as if you're an Olympic athlete training for the event. And by the time you get your prosthetics fitted, you're Olympic ready, if that makes any sense. So hopefully someday, as all these technologies become more readily available, that again, kind of going back to the military, it almost reminds me of that old TV show of the $6 Million Man, where if you're wounded in service, in the line of service, we literally can rebuild you. Not only rebuild you, potentially even rebuild you stronger, better, faster. I mean, really, that is the global vision. And honestly, Tim, I don't think seeing this as a reality within our lifetimes is really science fiction, but something that will come to fruition.
Oh yeah, the technology is moving so quickly, and you and your team are really pushing technology in a lot of ways. Speaking of building the future and bionics, tell us more about the OHSU powered exoskeleton, and can anyone who needs an exoskeleton afford one?
So I have to say, right before the pandemic, when we had the stay-at-home orders, we were within months of having the first prototype. We've identified our first patient who was in a motorcycle accident, has a brachial plexus injury, and we are honestly, again, all the things you saw with the modular prosthetic limb, with individual finger control and intuitive control, we've applied to the exoskeleton. So it's still kind of in really early stages of development. However, our goal again is to provide this and potentially even license out the design for anyone who's interested in kind of taking it to the next step. But if you know of anyone or the audience out there who is interested in this technology, please feel free to email me, because the number of individuals out there with either plexus injuries or have upper extremity weakness secondary to stroke. I mentioned this in the talk, but I feel as though this truly is going to be my greatest contribution with all the things that I've done. And you guys, you're not going to believe this, but the cost of this, just materials alone, with all the electronics, motors, and all the things with 3D printing, we can make this for about $500. Existing technologies out there are super heavy, very cumbersome. The motors are within the exoskeleton itself. And because of the external backpack and the cable design, our exoskeleton weighs only 8 pounds. So, I'm super excited about this project. And again, anyone who's interested in either, helping us out with further development, please reach out.
Wow, that's absolutely amazing. Another question, Dr. Chi, not many people realize that the great work you shared with us today is your side job, and that you spend the majority of your day as a trauma surgeon at a level 1 trauma center, OHSU. How do you find time to pursue your innovative work and stay focused on your day job?
It's a little, yeah. Well, I love all my philanthropic work, I have to tell you, and I love my job too. And I couldn't imagine giving up one or doing either one of them less. But I have to tell you, these projects that we're a part of, with the children and helping people, and it's life-changing technology that we're providing for people. And it's that kind of less moment, right? Like, it's not just coming in and having a sample of the technology. Our goal is to give this and have you take the technology home And some of these fittings, working with the children, seeing the smile on their face, Ollie taking that first swing for the first time and the joy and elation afterwards. I have to tell you, it's so moving. It motivates me not only for the year, it motivates me to get up in the morning to want to do even more. And again, I cannot stress my appreciation to the foundation. We talked about how, you say it's my side job, but, it's my passion. And all of the funding, all the equipment in the lab and the salaries of the engineers, Tim, it's come from you guys, from the OHSU Foundation and the donors who are watching today. So, you guys, thank you, and it motivates me on a daily level, and I can't imagine doing anything else.
Well, thank you for sharing that. I know our supporters are absolutely inspired by the work you do. They love hearing that their contributions are doing so much and so quickly. So now on to some current events. COVID-19, it's changed everything for all of us. We're living in the new normal, and it's really shifted your attention to developing this affordable 3D printed ventilator. If we see another wave, what do you think it would take to just get this ventilator into the hands of hospitals, not just nationally or locally, but around the globe?
So we've gotten really far with the FDA EUA process, and I kind of have one hurdle that's in front of me, and it's really finding one more collaborator that will help me distribute the device. So we've gone through all the testing. We've gone through meeting all the manufacturing and regulatory requirements for the design. That it's really this last step. If anyone again out there who has someone that I could talk to, or even a suggestion of how to move this forward, we're still looking internally how to do this within the university setting. But ultimately, once we get over this last hurdle, the real vision of this through 3D printing was to provide this gift to the entire world. And I mean gift meaning we were not going to charge for this ventilator. 3D Systems have agreed to, build the ventilators for free. And it's really just this last kind of step that we will be able to make that happen. And then long term, like you mentioned, I think 3D printing really has pushed the envelope of what is available. The reason why there was such a push to create all these different ventilators was there was a huge supply chain issue. People couldn't build the ventilators because you couldn't get access to the materials. The wonderful thing about our design is that literally we could just ship the files off, and anywhere who had the capabilities or a 3D printer available to them could print this in just 6 hours. Not only that, if you had a makerspace or a manufacturer with 3D printing capabilities nearby the area of need, you could print this within hours and then have vents delivered the very next day. So I think the potential for this is tremendous. We still have some work in front of us, but we're going to keep plugging at it until this becomes a reality for us.
Wow, fantastic. Just curious, the components that go with the 3D printed pieces, are these proprietary special parts that you have to have manufactured, or are they components that could be found readily anywhere in the world virtually?
So the first prototype, our goal was to make something that anyone could make literally in your home. Off-the-shelf products, you could go down to Home Depot, get some silicone seal to make our valve, a couple screws, a spring that was readily available. So the answer to that is yes, you could make this literally in your garage. However, the responsible thing to do, and again, we needed to do this for the FDA approval, was to come up with a manufacturing process that met certain standards. And right now, the answer is yes, you could build this with off-the-shelf parts, but in order to actually produce this and have it manufactured, there are certain standards that we have that you have to make sure you have a reliable spring. Not only that, if you run out of that supplier, what's your backup supplier? And it was really such a learning lesson for me going through this FDA process, and thank goodness for it, because I definitely needed that knowledge for all the technologies I'm a part of. But right now the path forward is more having to meet all those regulatory standards. But for those listening right now, you could literally, if you had the files, you could build this in the comfort of your own home.
Wow. So these are open source files?
Yeah, Tim, right now they are not. I really do. I thought we really struggled hard with this, whether to make this open source, but we thought, you know, we're talking about a ventilator, right? The potential device that's going to go on a patient that could be life-saving, or if it didn't work, you know, you would have the opposite effect. That we didn't make it open source. I do think the future direction of all these things would be, by things I mean, medical devices that are 3D printed, and you've seen all the outpouring with PPE and all these other different applications with 3D printing. Is maybe having a vetted bank of designs and maybe vetted areas that could actually meet those regulatory standards for printing. That, again, open source meaning anyone could have access to it, but then also ensuring that the devices are manufactured safety and meeting regulations, so that when placed on a patient, you have the confidence that it will function properly.
Yeah, quality control has got to be paramount for sure.
Absolutely.
With a life-sustaining and life-saving device. How long does it take for you to print a ventilator?
Yeah, that's a great question too. It depends on the printing method we use, but with our current printing method, in about 6 hours, believe it or not, per ventilator. And with a company like 3D Systems, it's not just one ventilator in 6 hours. They can actually print multiple ventilators in 6 hours. And again, they have committed to us to 100 ventilators per week during this pandemic once we get our FDA approval.
That's phenomenal. So in the media, we've seen a number of different ventilator designs that are designed for emergency use. They've come about because of the pandemic, and some are FDA approved. How does this one that you guys are doing differ?
The engineering community and medical community, I mean, really should be commended for all these designs. They are all so wonderful. NASA actually just recently got approved for EUA use of one of their ventilators. Look, our design, the way it's different, and not to say it's better than any of the other designs, but our purpose was something that could be rapidly prototyped, rapidly manufactured for very austere environments. It requires no electricity. You can imagine it. All it requires is a oxygen source and flow. So if you can imagine, I mean, this could be applied, and it really opens up the possibilities for very austere environments in areas that really have very, very limited resources. We have everything tested and mapped it out, that there's even a flow diagram how to make your adjustments according to whatever and how the patients are responding. So this eliminates the need for the biomedical upkeep of the device itself. We can make it for less than $20. We're applying for the FDA device as a single-use device. You can almost think of this as a disposable device, even though I've said that you can use the device for over a week without any performance changes. We've picked a material where it can be autoclaved. However, our official recommendation would be just single-use device. And however, I do think there are potential uses for multi-use device for our ventilator as well. So, there are wonderful technologies out there, but I feel as though our design is so pure and simple that I think the applications for it could reach a much broader patient population.
Wow, that's great. Well, the intent behind it is absolutely pure. That's for certain. Several times in your presentation, you had mentioned philanthropy, how it's made a lot of things possible. Can you share a little more about that?
Oh gosh, Tim, like the entire lab is supported through philanthropy. Both my engineers, their salaries have come from the generous gift of our donors. Fast Pitch Cares, I'd like to give them a shout out. They've been kind of our guardian angel through the pandemic. Just last year, the foundation account, we were just so happy to get two of the engineers on board. And when the ventilator design came to a point where we realized there was a piece of equipment we needed, I did not have the funds to purchase that piece of equipment. And it was a phone call to Fast Pitch Cares, Sue. If you're listening out there, thank you. She met with her board within hours and she got approval for this gas flow analyzer, which we are using every single day since the inception of the design. And we're using it every single day for the FDA EUA process that was instrumental in us getting to where we are at. So again, I can't begin to thank the individual supporters out there, the organizations that have supported us. That Tim, I tell you, you're my greatest supporter as well. But none of the things that I showed today that involve 3D printing would be here today if it weren't for the foundation.
Well, that's great to hear, and a huge shout out to Fast Pitch Cares, Sue, and the other donors for making so much possible. I just was told that we're getting close to our time, so we have enough time for one more question. And the last question is, are there other ways our viewers and community can support your work?
I would love it if those listening, if there's anyone whose lives could be touched by some of these technologies, whether that be a small child who was born with congenital limb loss, to give me a call or email me, or individuals who could use an exoskeleton or is interested in participating in some studies. And I promise to everyone who's listening out there, the only thing this is going to cost anyone is their time. It's a passion of mine, and each individual that we meet, again, it is such a joy. These patients that come, it motivates me on every single day. And lastly, too, if anyone, if you're interested in this route, any kind of donation or financial support is greatly and always appreciated as well.
Absolutely inspiring. Thank you again, Dr. Chi. Einstein once remarked that creativity is intelligence having fun. You and your team are clearly a reflection of this idea, an example of OHSU at its best. And thank you to everyone who joined us today. We'd love to get your feedback on this presentation. In the chat box, you will see a link to our quick 3-minute survey. Also, if you want to learn more about how you can support the incredible work of Dr. Chi and his team, please include your name and contact information with your survey. This concludes our webinar. Have a fantastic day. Stay safe and stay healthy.